Hello and welcome to today's webcast. I'm Lisa Ward, the Director of Education from Maddie's Fund. I'm here in beautiful Pleasanton right now hosting this webcast. Today we are exploring a topic relevant to all of us, but perhaps especially to those who work in the animal care field. Ergonomics and how studies have shown that we can improve not only our well-being at work, but optimize our work systems too. Joining us is Dr. Sara White, the founder of Spay ASAP Incorporated, a nonprofit MASH-style mobile spay-neuter clinic. Since 2006, she's spayed or neutered over 50,000 animals. During that time, Sara developed an interest in the health and well-being of veterinarians and staff. In the spring of 2015, she received a Master's of Science and degree in Health Ergonomics from the University of Derby in the United Kingdom. She then founded ErgoVet, where she provides information and consulting in veterinary ergonomics. In 2018, she was honored by the Association of Shelter Veterinarians with their Veterinarian of the Year Award. Welcome, Dr. White.
Thank you. All right, and thank you all for coming today. I'm excited to get to present this topic to you, and I hope that you learned something, and so here we go. First, I want to tell you a little bit about me and how I came to be interested in ergonomics and spay-neuter and shelter practice. I've been in vet practice for 21 years, and all of those years I've been in Vermont and New Hampshire. I started out in a mixed practice for my first year and a half, and then was a shelter vet for another 5 years. And then 13 and a half years ago, I started doing MASH mobile spay neuter. Over the years, I ended up talking to a lot of veterinarians who work in spay neuter and in shelters, and heard about the ways in which their bodies hurt, or heard about the ways in which they felt like the scheduling of their work wasn't appropriate, or that the scheduling of their staff's work wasn't appropriate, or that were they being worked too hard. I also heard from veterinarians who were managers and who weren't sure whether all the vets working for them were a bunch of wusses, or if they really needed to schedule less work or a different work schedule for them. So I decided to do some research, and then learned from my research that there was so much I needed to know about ergonomics that I went ahead and applied for an online master's and studied that for 3 years. So that's how I got to where I am now. You'll also see from the picture on the screen that I adopted a puppy last month during the webcast, but because he is being attended to, but he has been my exciting new family addition this month, or this last month. So let's start with what is ergonomics. Most of the time when we think of ergonomics, at least in American English, we think of physical ergonomics. So lift with your legs, not with your back. Or we think about ergonomic products like an ergonomic keyboard or ergonomic mice. A lot of kitchen utensils will say ergonomic, office chairs, desks, that sort of thing. And this is all true, but it's only a tiny part of it. We may also think about pain when we think about ergonomics. So carpal tunnel, or a sore back, or disc trouble. But really, ergonomics, at least according to the International Ergonomics Association, includes the whole work system and the person in it. So they would define it as the aim of ergonomics is to study and improve the fit between people, their jobs, and their environment in order to improve performance, well-being, safety, and health. So that's really important to think about. The point of ergonomics is to fit the person and improve the fit between the person and the task. And they would also say to fit the task to the person rather than trying to modify the person to fit the task. So it also includes physical, which is what we've been talking about, but also cognitive, environmental, and organizational aspects of work. And by that, I mean, so examples in small animal surgery, physical ergonomics would include things like humans interacting with patients and objects, lifting, standing, sitting, typing, driving a vehicle, doing surgery, any of the things that you do that physically interact with a patient or an object in the course of your work. Cognitive ergonomics and physical ergonomics is what we're going to end up talking about today. But I think the others are worth mentioning and worth considering before we move into the rest of this. Cognitive or ergonomics involves things like mental workload and mental tasks. So this could be like a divided attention task. A technician who's watching a surgical patient, recovering animals, listening to electronic monitors, and trying to be attentive to coworkers at the same time. And I point out, I use a technician as the example because just like in human nursing, it's the nurses more than the doctors who are probably having to deal with the high divided attention and high cognitive workload in a lot of the tasks. Hopefully, if you're doing surgery, if you're the surgeon, you are able and allowed to focus a lot of your attention on the surgery and don't have as many competing mental tasks as your technicians might. Environmental ergonomics includes things like the temperature and the noise, the lighting, and the airflow in the environment. And then organizational ergonomics is systems and management style and communication. So this may seem like it's way outside of the realm of what you think of as ergonomics, but you'll see in a few minutes that the way that a work organization or work system is managed can have a big impact on the physical pain that the veterinarians or staff are experiencing. So it's really all a big circle, all a big cycle, and important to think about as well. So a quick run through what we're going to be talking about today. Some research on spay-neuter veterinarians. And then I'm going to talk a little bit about, in general, how to approach ergonomic risks or any risk in a workplace. And the reason for that is I'm not going to cover everything that you might be wondering about or thinking about in ergonomics, but this will give you a little bit of background, like, okay, how do I start? How do I approach? Then I'm going to go through some specifics for ergonomics and surgeons, the physical environment, the surgery itself, instruments and needles, and movements and postures during surgery. We'll talk a little bit about perioperative staff ergonomics, and then I want to touch on dentistry as well, because that's another thing that increasingly shelter vets are doing, and that can be a pretty big ergonomic risk, or that can be set up in a uncomfortable way depending on your work environment. So first, do we have a problem? Is there a reason why we need to be studying ergonomics in veterinary medicine and in spay-neuter and in shelter medicine? So in a survey that I did in 2011, so some of you may have participated, and it was published in 2013, found that 99% of the vets who answered the survey had experienced some musculoskeletal pain in the last month. 98 had pain somewhere in their body, 76 in their hands specifically. And this actually fits pretty well with other surveys of veterinarians, where between about 80 and 96% of vets report musculoskeletal discomfort. And I think I don't say this on any of the slides, but 99% experienced pain, and about 91% attributed the pain, at least in part, to their work in spay-neuter. So even though all of what people experience isn't due to their work was at least contributing or exacerbating, or it was perceived as doing so. So where does it hurt? Okay, this is a map just to look pretty briefly at where we're uncomfortable. Lower back, shoulder, and neck are the three regions that are the highest prevalence in spay-neuter vets for pain. And lower back pain is really common in the population. So of surveys of adult humans, you'll often find that somewhere between 60 and 80% have low back pain. But the neck and shoulder pain is unusual in surveys of humans in general, of adult humans in general. And this is more like surveys of human surgeons. But normally you would see neck and shoulder pain something more like in the 30 to 40% range. So I think that neck and shoulder is a big place where we're seeing effects, and low back, of course. And in the hands, it seemed like the biggest areas of pain were the right thumb and wrist, and to some extent the right index and middle finger. And this was true in the left-handed veterinarians as well, and maybe, I don't know why, but it may be to do with how they're using their instruments, because instruments aren't typically designed for lefties. So, so thumb and wrist and forefingers are a big place for pain. So what characteristics of the work contributed most to the pain score? Hours per week were the biggest contributor. Next was years in spay-neuter. So the more you worked per week and the more years you did it, the more likely you were to experience pain. Then the next thing was job satisfaction. So that incorporated how people felt about their job, how stressed out they were by their job, how much they felt like their job was a good fit for them. Next was number of surgeries. This didn't actually have a very big impact if you separated it out from hours per week. And then surgical speed was the least contribution, which kind of fits with number of surgeries and hours being separate. So if you're fast, but you can get a lot of surgeries done in, say, 15 or 20 hours a week, then you'll be a lot better off potentially than the person who does the same number of surgeries, but it takes them 30 or 40 hours a week. But the other thing to note about this is that even though we've laid it out with here's the biggest contributor, here's the least, these are all relatively small. They explain only a small amount of the variability that we saw in the amount of pain that people had. So maybe they would explain 5% of your chance of having pain. The rest of it is probably your genetics, your activities outside of work, the amount of exercise you get, and any other factors that we haven't thought of. So this is important, but it's not everything about how you're going to feel during surgery. Other things that I was saying in the beginning, that job stress and dissatisfaction are important, that organizational ergonomics actually affect physical pain. And we were definitely seeing that as people rated their job increasingly as stressful, and that they rated their satisfaction as less satisfying, the more areas they were finding pain and the more severe their pain was. So it really is important to consider, if you're experiencing work-related pain, to look at not just your physical environment, but your psychosocial environment as well, if you have the ability to do that. And I don't think that it's all just one thing. I don't think that pain is necessarily directly caused by job satisfaction. It may also be a cycle and feed in different ways. So if you're in pain, you may be less satisfied with your job. If you're in pain, you may be more stressed. So it's not just a cause and effect in one direction. We can only say there's a correlation or an association, not which way it's being caused. And similar to what we saw in the poll at the beginning of today's presentation, most people haven't received any formal instruction in ergonomics. Some people have learned a little bit in vet school, or have studied it on their own, or have learned about it in non-veterinary venues, but by far over half of veterinarians have not had any formal training in ergonomics. Okay, so moving on. Here's really quick how to approach risk in a workplace. And I'm going to talk about the risk control hierarchy, where if you have a thing that you think is risky in a workplace, say you think that lifting animals is a risk that is a problem, the ways that you can approach it are to eliminate the risk, substitute it, use some kind of technology to change the task, keep people away from the risk. So that would be like putting a caution sign on something. Administrative, making rules to minimize the risk, use personal protective equipment, or discipline people who are not following the rules. So here's a chart of the same thing. So the closer to the top, the closer to that blue zone you can be, the better your chances, the further down, the less. So most of the time we're not going to be able to eliminate, maybe not even substitute the risk, but those are the ideal. And hopefully there are very few things where administrative controls and personal protective equipment are really all that helpful. And not every problem will be amenable to all the controls. So you can't absolutely eliminate the risk of injury from animals in an animal care setting, but the higher up you go, the better. And I think I have some examples later in the show of that. I've sort of taken some of that from another presentation, so there's not as much detail in that, but just something to think about. If you do have problems that you're trying to approach that I haven't covered, then think about the bigger the change you can make rather than trying to just educate or make rules about it. Okay, moving on. In ergonomics and the physical environment in surgery. So how do you know what you need to change? How do you know which things are a problem? Most of us now have some ability, some video camera that we carry around in our pockets and call a phone. I have taken videos of myself when I find that I have a problem, or if I want to learn something about how I do surgery, that rather than just taking a video of the surgery itself where you can see hands and technique, actually stepping back and taking a video of how your body posture is, what your head and neck are doing, what your back is doing. So in this case, I had the phone propped up behind me because my shoulder had been bothering me. And I realized I really do have my shoulders raised here in a place where I've got an appropriate height table. I don't need my shoulders up at my ears. So just think about getting a video of yourself and looking at it later so that you can actually see what you're doing. And if you can't do it, I have done this usually by taping my phone to something or propping it up on something, but you could easily have somebody else tape it for you, or if you have a tripod, you could set that up somewhere as well. All right, so the height of your surgery table and the positioning of the patient are important things that actually influence your posture a lot. And it doesn't have to be expensive. So a table that's too high will make you raise your shoulders and potentially have to abduct your elbows, raise your elbows and move them out. And all of that will take a lot of muscular effort and can make you pretty sore, and especially the muscles that you're using to elevate your shoulders and arms will be pretty sore, your neck and shoulders, again, the surgeon area to be sore. Meanwhile, a table that's too low will make you lean over, and so it will put some stress on your lower back and upper back. And so the table that is just right, you're able to still stay standing up without any excessive reach or head angle or bending. And I know that not everybody's working in an environment with a adjustable or an adequately adjustable table, whether we are working in a MASH setting like I do, or you have a table that is designed for people who are a different height from you, or you're working with people who are a different height, or your table is just old and it doesn't adjust anymore. Think about can you stand on something to elevate you, or can you elevate the table that you're using? And in one picture here we're just using foam board insulation and a couple of wooden blocks to get a table up to the height that I need it to be comfortable. Another thing that I actually learned from, or first observed in a vet, who was working as she was pregnant, was that the further along in her pregnancy she got, the closer she had to move the patient on the table. Otherwise, she couldn't even reach the cat anymore. And it occurred to me that when I had a small cat on a big table, and the technician would naturally set the cat up right in the middle of the table, that was putting me in a bad posture. And that if I would go ahead and move the cat a little bit closer to me, and this may be a little extreme in this picture, but if I moved the cat a little bit closer to me, I wouldn't have as much reach. Now, I don't want it to be too close or my head angle gets too steep, but do think about, if you're having to reach or lean over in order to do the surgery, then you might need to move the patient closer to you. Another thing that I've seen, and just doing Google searches on space surgery or space surgeon or something, that you'll see pictures where people have positioned objects in the room in such a way that they are forced into bad positions. So this is an illustration that I made based on a photo that I'd seen online, where the instrument tray was high enough that it was, and in such a close position that it was causing the surgeon to always have her arm lifted up as extremely as in this picture. And there's really no reason why in this case the tray couldn't have been lowered, or the instruments couldn't have been placed between the patient's legs, or some different positioning to allow her to have a more natural posture. Another thing is that in school, at least I was taught to stand for surgery. Unless you were with the ophthalmologist, you were standing. And, again, in speaking to pregnant surgeons, they would say, oh, yeah, I sat for most of my pregnancy, and that was fine. And it turns out that in human surgery, there have been some studies of people who sit at least some of the time for surgery, and that they have less fatigue in the spine and lower limbs specifically at the end of the day. So if you normally stand for surgery, it's worth thinking about sitting some of the time. In my case, in a MASH clinic, where I only have one surgery table for most of my surgery patients, I do my cat neuters throughout my cat, interspersed between my cat space. And I do the cat neuters at a regular table with a regular chair. So I sit down for my male cats. And it's not very much time during the day, but it's forcing me to change my position every time I go and do a male cat. So I think that actually does make a difference, that you're putting pressure and you're making different muscle groups work during the day. So, but things to think about when you want to sit for surgery is how to get your body into the right position so that you're not leaning or reaching or otherwise encumbered by the fact that you're sitting. So it's not hard to figure out with a small patient. So if you're sitting with a cat, you can probably get into a pretty good orientation with just a regular stool or high chair that comes up to the table. But once you get a deep-bodied patient, you'll find that you're having to lift your arms pretty high to get out of the way of the animal's body, and that you can't raise your chair anymore because your thighs bump up against the bottom of the table. So sitting in a saddle-shaped stool or a sit-stand stool can be a way to raise yourself up, keep your body posture pretty straight, and move your body closer to the table without that interference with between your thighs and the table edge. And there are a lot of different types of saddle stools out there, or other sit-stand type stools. A lot of people use them. I think you still may run into trouble if you have a pedestal table, getting that seat to work well with the table. So you may need to play around with it a little bit, although the sit-stand stool that's in the bottom center of the image may be able to accommodate even a pedestal table. And that some people find that they're not comfortable sitting in one of these for an extended period of time. But if, for example, you had one table set up with a sit-stand stool or saddle chair, that you could then have a standing table as well. So you wouldn't be stuck in that position. You wouldn't be stuck with the weird pressure on your inner thighs, but you also wouldn't be stuck with the foot fatigue and leg fatigue that you would from standing all day. So just something to think about that a lot of people do find helpful. So a saddle chair can really help your posture. These are some images from a study that was published using dental students as their subjects. And you can see from the picture on the right, this student is able to keep a much more aligned body posture, especially head and neck posture, using the saddle chair. Some things are pretty intuitively obvious, but it's nice to know there's actually some research behind them, that using floor mats when you're in surgery, standing on a floor mat, will decrease your discomfort and fatigue. They haven't been shown in studies to decrease back pain, but still decreasing foot and leg pain is good. The perfect mat is usually a not too hard, not too soft mat. You don't want something that's going to ground you out where you step on it and it's like stepping on a mattress. But if you're on a hard mat, you don't have the comfort level. So regardless, you want something that's non-slip, that's cleanable, that's resistant to fluids. So if you have a blood or pyometra spill all over it, that you're able to salvage it and clean it up, and rather than having it soak in. And my advice on mats is to try them out whenever you see them. If you see a floor mat anywhere, step on it, see if you love it, find out what kind it is. And footwear, you want to wear cushioned shoes as opposed to hard-soled shoes. And that some studies have actually found that wearing different shoes on different days can be helpful, whether that's different shoes for different days of doing the same job, or just making sure that you're wearing different shoes on different days doing different activities. At least in my experience, it can be, my favorite shoes for surgery are not great shoes for walking around all day. So if I'm in a workplace where I'm expecting to be able to stand and sit and do surgery all day, then I'm going to choose some really soft, squishy clogs. But if I'm going to be walking around between patients and doing surgery, so more like a shelter day where you're doing all kinds of tasks, then I'm probably going to have some running shoes, some athletic shoes. But I like to have both kinds of shoes available just to be able to increase my comfort or increase my chances of finding the shoe that feels the best that day. Okay, and one thing that I have added to this show during the last few years has been about wearing glasses, because I have recently reached the age where I need glasses in order to see my surgeries. And when I first started wearing glasses during surgery, I was just using over-the-counter regular readers, which allowed me to see the surgery, but because of not having any lens nearest my cheek, it was actually changing the angle of my view and therefore changing my head and neck. And you'll see in the next slide how having glasses, in this instance, having glasses that have that gap below the eye means that the surgeon has to have a steeper neck angle, where what I ended up doing was getting a pair of glasses that were half glasses that you're meant to be able to look over, and you can see the picture of me in the corner with my half glasses on. And because they are using the lower part of my visual field there, they are still allowing me to keep the neck angle that I want. And also still allowing me the ability to see longer distance, which I can see without glasses. So I can see my technician, I can read the monitor. And so for me, this has been a good example. For a lot of people who, if you need distance correction as well, or if you don't like the kind of grandma look that I have achieved here, then you might choose to get progressive lenses that allow you to have that multi-distance focus and that still cover that lowest part of your visual field. Some people use contact lenses for near vision, so that may be an example, and that saves you from the other glasses problem, which is your fogged lenses. So again, my next slide was showing that how the angle of your glasses can change the angle of your neck and shoulders. And then when I was starting to need corrective lenses, I thought, well, what about loupes? Is that what I should be doing? And this is an image that I've taken from the dentistry slides that you'll see at the very end of this presentation. But you can see here, this veterinarian has a face shield because she's using the high-speed drill. She's got some loupes, and then she's got some, so this is for magnification and illumination. And with the angle of the loupes, it's forcing her visual field to, or forcing her eyes down so that she has a good neck angle even though she's looking down at her patient. But the thing about loupes is that they don't have any magic in them, that they don't have any mirrors or angles in them that changes your visual angle. They're just a way of forcing your eyes to do the work that they should have been doing all along. So the loupes are changing your visual angle only by being small and in a certain place. So they're not going to make your neck angle better than what your neck angle would be without glasses, or what it would be with low set magnifying glasses. The downside of loupes for general surgery is that they drastically decrease your field of view. So you may have only a 10 or 15 centimeter field of view, which seems like it's fine because when is your incision ever longer than that? But then you realize how much you are visually tracking where the end of your suture is, where your other instruments are, where you've set your thumb forceps. So that narrowed field of view, I think for most general surgeons, for most spay-neuter vets, is probably enough to mean that loupes are not a practical solution for magnification during spay-neuter surgery. But I do think they can be a great solution for smaller surgeries. And then what about fogging lenses? So if you're wearing glasses for whatever reason, you will notice that, or especially if you're just starting to use glasses, you'll notice that your lenses can fog up. So there are a lot of solutions to that. One is a fog-free mask, which just has a strip of foam or a strip of adhesive to keep your breath from going upwards. Short of that, some people use a piece of tape over the bridge of their nose to do the same thing. Some people use anti-fog solutions on their lenses. And there's been a paper published in the human field about crossing the ties of your mask behind your head in a crossed way so that the lower ties are tied at the top of the head, so that your breath comes out the side, which is good for fogging, but maybe less good for asepsis. So I'm not necessarily recommending it, just saying it was something that was published out there. And again, contact lenses are another way to solve the fogging lenses problem. So, okay, I think that is going to be it for the physical. Moving on to surgery techniques and movements. And this is mostly going to be thinking about the pain that people experience in their hands and wrists and maybe lower arms. Surgical tasks in spay-neuter require a combination of repetitive movements, force, and awkward positions. And alone, each of these three factors is only moderately associated with pain, but when combined, it is a strong association. In studies going back more than 20 years, consistently across many studies, if you're doing something repetitively, forcefully, and awkwardly, it is very likely to cause pain. So repetitive motion is inherent in any high-volume workplace, but if you think about the tasks that we're doing, we are actually reducing the repetition by some of the techniques that we use. So if you're using pedicle ties on your cats, auto ligation on your cat pedicles, you're tying fewer suture knots. And if you have a shorter incision, you're also placing fewer sutures, tying fewer knots. And if you're using an efficient technique, so you're not wasting motion, that decreases your repetition as well. So any of these things that you're doing that are increasing the quality of your surgery are also probably increasing the quality of your ergonomics. There are a lot of different awkward or tiring hand positions that you could be using. Some of them are just the way the instrument is built. So the pinch grip of the thumb forceps, that's the way that instrument is built. So that if you are using that position a lot, if you're using it with force, then that may be something that will cause some thumb pain or be related to some thumb pain or wrist pain. So for some people will minimize the use of thumb forceps during closure, especially for subcutaneous skin closure, so that you're using your fingers to stretch the tissue. You're not using the thumb forceps on the skin, and you're not having to use that pinch grip as much as well. So, and I also want to comment that awkward postures are not usually required for spay-neuter surgery, but that doesn't mean that you're not doing them sometimes. So another reason to consider videotaping yourself or videoing yourself doing surgery is to find out if you're doing things that you could change. So some postures that you can be using are extreme supination or pronation, so where you've turned your arm so that your hand is completely palm up or completely palm down. Those are not bad postures, but if you're doing a lot of switching, if these two top pictures were both from the same doctor doing one stitch, that would be a lot of motion and might be associated with some discomfort or fatigue. Also, the picture on the bottom, it might be a little bit the product of the angle that the photo's taken, but I think it actually is an ulnar deviation of the wrist. So canting the wrist away from the thumb towards the pinky about 50 degrees. So that's also something that if this surgeon is doing that every stitch and using a lot of wrist motion every stitch, that's probably going to be associated with some pain and fatigue. And it might be something that individual surgeon can improve. And it is also certainly something that there are many surgeons who can do the same placing sutures without ever having that kind of angulation. Another thing that you might think about if you're having hand or wrist pain is changing your instrument holder your needle holder grasp. And I wish I could tell you that one needle holder grasp is the best and causes the least amount of pain. And there's not necessarily a best answer. Some people who use the palm grasp that is labeled and shown on the right of the screen is that people will swear by that and say that that it definitely has saved their hand comfort. When I have surveyed a bunch of people who do use each of the grips, it's not as consistent as I would like to be able to say one is better than another, but it definitely is a way to change how you interact with your instrument, how your body interacts with your instrument. And for some people who are having trouble with their hands, then considering switching to a different grasp may be a way to make them more comfortable for surgery. Another thing to think about in a place where we use forceful motions in surgery is in knot tying. Secure knot tying means that you have to apply forces equivalent to about 80% of a suture's breaking strength. So if you're using a monofilament synthetic suture, in order to get those suture throws tighten down enough to really be a secure knot. Then with 3/0 suture, you're probably using 3 pounds per throw. With number 1 suture, you're using 9 pounds per throw. And so a repeated load of 9 pounds is associated with ligament inflammation and muscle excitability. So not saying that you would have the same patient where you would say, oh, I'm not going to use number 1, I'm going to use 3/0 instead. But that you don't want to use suture that's bigger than what you need for the surgery that you're doing. And you may, if you have the ability to do so, may want to switch between different sizes within the same surgery, so that if you're using a large suture size on, say, on the pedicles and body wall, that you might use a smaller size suture for the skin and sub-Q. So because the patient's body will like it better, and your hands might like it better as well. All right. Another place is where you're using some force. I would say big dog neuter and maybe big cat neuter as well. Some of these tomcats get a lot of fibrous connective tissue, and that it takes hand and arm strength to grasp and exteriorize the testis during a closed castration in large mature dogs, and to get a grip on the testicle in large mature cats. So ways to decrease the amount of strain in a big dog neuter would be to switch to open castration. So that there are potential disadvantages to that as well, but many people do and swear by open castrations. Also, sharp dissection of fibrous attachments around the vaginal tunic, between the tunic and the sub-Q tissue. So there's a lot of things that you may be trying to break down by hand, but that you could actually use your blade to break down those tissues. And also you might find that once the spermatic cord is exposed, so once you've just begun to get the testicle separated from the scrotum, that you can use a hemostat to clamp the cord just proximal to the testes to give you a different grip, to give you an easier grip on the testis, so you're not, so your wrist isn't as steeply angled, and so that it's an easier grasp. And I actually use this technique more with my tomcats than I do with the dogs, where I want to maintain a closed neuter, but I also want to not have to pinch my fingers as much as I need to hold on to that tomcat testicle. All right. Another thing that I learned from videotaping myself doing surgery was that I was doing my continuous intradermal suture the wrong way. So as a right-handed surgeon, performing the continuous closure from left to right meant that I was leaning over and raising my elbow, twisting my body. And instead, if I had just done the closure, oh, here I am doing it in a video screen grab. But if I'd just done the suture in the other direction, so performed from right to left, I didn't have to raise my elbow in the same way. So if you're doing something really awkward, there's probably some technique thing. If you're not finding a physical environment thing, then it may be a technique thing that's causing you to do that. Other things like crossing your arms during surgery, another screen grab that I realized how awkward that was. And I started reaching more with my left hand for my instruments, or learning to pick things up with my left hand. Or obviously standing on the other side of the table, or having your instrument tray on the other side of of your body. So other things you can learn. Instruments and needles. I'm just going to go through this really quickly. The main point is that if you have stiff instruments and dull needles, they're causing you to use a lot more force. And so you don't need to do that. You need to try to get instruments and maintain instruments to be as easy to use as possible. So if you have the ability to make purchasing decisions and you're getting supplies for a new surgery suite, then great. Find things that you've tried out at trade shows that feel good in your hands. And if not, Make sure that you are sending off things to be sharpened when they need to be sharpened, that your staff are maintaining the instruments properly, that you're giving them the supplies they need to maintain the instruments properly. And if you have dull needles, if you're using reusable needles, then throw them out when they're dull. It's better for you and it's better for the patients as well. Even with everything done right, you may still be using poor posture in the operating room. There's no reason in this picture why the surgeon has to be leaning over like this. She sort of believes she has to be looking really closely, but yet she can see whatever she needs to if she stood up straight. So another reason for videos and another reason to look at yourself doing surgery. This is a picture of me doing surgery some years ago, and even with a fairly good surgical posture right here, my neck angle is close to 40 degrees, and I think this is pretty hard to avoid in surgery, and is one reason why it's good to keep having the ability to change posture. And when I talk at the top of this about a neutral posture, neck angle is less than 10 degrees, that would be if you're just standing there, if you're just sitting there, what it should be using the computer, what it should be driving a car. So I think this is one of the big reasons why we see neck and shoulder discomfort in spay-neuter veterinarians. You know, other people you may see that people are, this is not a picture of me, people are using some strange resting postures during surgery, but it's also, if you see these postures, but they're symmetrical, they're not being held for a long time, that may not be a problem. So on the one hand, you don't want to see a surgeon being twisted. On the other hand, being able to rest a leg and doing something that's symmetrical may not be a bad thing. Also, during any surgery day, during any computer work day, it's a really good idea to take pauses during that time. And that can be really simple. 20 seconds every 20 minutes has been shown to make a difference in surgeons and in office workers. So that may be as simple as having a routine of shaking out or stretching as you move from one surgery to the next. So, and it may not matter as much what you do as the fact that you're just resetting all your tensed and tensed muscle positions. So definitely a big advocate for moving during the surgery day. And realizing that your ligaments adapt over time, so that surgeons that are just returning from an extended leave or are brand new to spay-neuter may not be able to do as many hours of surgery as somebody who has basically work hardened, who's adapted to the work. So consider bringing on new surgeons at a lighter workload or with more rest days in between until you know that their bodies are up to the task. All right, and physical fitness activity overall is very important for reducing fatigue and pain during work. So all that general stuff. Okay, I want to really quickly, I know that I want to leave a little bit of time for questions, but I also want to recognize that there are a lot of other things in shelter medicine and spay-neuter, in veterinary medicine in general, that are risky ergonomically. So lifting, prolonged standing and sitting, handling and restraining animals is a big one. Repetitive manual tasks that are not surgery, things like drawing up and injecting drugs, clipping and prepping for surgery using the clippers or the vacuum, using a computer, using a car, using a phone, and noise in the environment. Again, the slide I showed you earlier, looking at how to approach an ergonomic risk. So for patient restraint, you may have to get down on the floor, you may have to hold against wiggling, you know, all these things that may make patient restraint complicated. So the way to approach that would be learning appropriate restraint techniques and having equipment and protection when necessary. For lifting and carrying, you can't necessarily modify the weight of an animal, but you can lift with more than one person. Lifting is going to change, your ability to lift is going to change by how far your hands are from your back or how high you have to lift. So if you're lifting off the floor, it's harder than lifting from something that's above your knee height. Twisting and side bending are risky. Working in a restricted space is risky. So trying to be able to get the obstructions out of your space before you're in the middle of trying to lift a patient. Getting a good grip, having clean, dry floors, and communication and coordination. So some of this could be using a stretcher to lift an animal, coordinating with another person to do that lift, using lift tables when they're available, things like that. Repetitive manual tasks can be that bad combination of repetitive movements that require force in awkward positions. And so things like thinking about the weight of the clippers that your staff are using, and they may like the heavier clippers, they may like the cordless clippers, but it's something to think about, the amount of force that they may be using if they're prepping dozens of patients through the day. And if you're using an awkward position, it's that much worse. So watch people's wrist angles during clipping. Watch that they're not having too much of the same motion. Okay, just a few slides of MacGyver Ergonomics. Not having to lift that vacuum hose, so it's hooked to the ceiling here. I've got a sprayer bottle here pictured that you're not having to use your fingers to spray. And a volunteer using a plastic sled. Currently, there's not a cat in the trap. She would have it better draped if there was, but just not having to carry that awkward trap across the snowy parking lot because she's got it on a sled. All right, very, very quick dentistry, and I'm sorry I'm going a little on the late side here. We definitely want an adjustable height table, and we want to have the ability to get your knees beneath it. And if you can't buy something like this, try if you can to rig something up so that you can get close to your patient. This is a great place for a saddle stool. This is a great place for having good lighting and for having loupes. So as we saw in the picture before, having loupes that you can angulate a lot help force your eyes to do the work rather than forcing your neck and shoulders to do the work. So because you're able, this is what loupes do, they force you to make that angle with your eyes. This is my friend doing some suturing on a patient, and she's changing the height of the table a lot during the procedure. So she's suturing the lower arcade with the table lowered, she's suturing the upper arcade with it raised, so that she can stay at a pretty comfortable position throughout. And again, our dental student picture, make sure that your chair isn't contributing to your bad posture. And there are a lot of different types of saddle seats that are available. With dental instruments, if there's a way to thicken the instruments, so using buying thicker instruments or putting silicone grips on them, that can help. Sharpening your instruments regularly, choosing textured handles, alternating between different types of patients and different types of procedures. Make sure everybody has the right size gloves, and using the instruments well. So that is it for today. That's the end of my presentation, and I would be glad to answer some questions if we have any time left, Lisa.
Wow, that was amazing. And I am not a veterinarian, but I definitely got some key ideas from watching the presentation. In fact, I thought here the whole time I was sitting, and I have a desk that goes up and down, and I wanted to raise it and do some stretches while I was sitting here watching the presentation, but that was fantastic. I think our questions right now, if we have some questions in there.
Okay.
So for most of them, I think they were either answered or tech questions, or we're looking pretty good. But there's so much information in there. I bet we have some questions as the day ends, and we might be checking back on the forum for questions. So that was fantastic. You have completed the task of the day.
All right.
We want to thank all of our viewers for watching, and for those of you who'd like to continue today's discussion, or if you have more questions for Dr. White, please visit the Maddie's Pet Forum webcast group. Might get people thinking after you've watched this, and they might have very specific questions. So much technical information in there. Thanks for watching, and thanks, Dr. White, for everything you did. That was wonderful, and thank you all for what you are doing to help the animals. Take care and happy holidays.